Ozempic is often prescribed to help with weight loss, help control blood sugars, and to treat type 2 diabetes. And this medication works by mimicking insulin levels in the body so that one will feel full after eating or get full quicker and feel satisfied quicker after eating. But research seems to show that this can also help one to not only treat type 2 diabetes, but maybe also treat alcohol use disorder and opioid use disorder. So not only does it decrease cravings for food, but it may also decrease cravings for alcohol or drugs. Another way to look at this is like eating food can signal this reward to the brain, which is similar to how alcohol or drugs can consider this reward signal to the brain. And so maybe this medication helps decrease that reward signal that one gets, not just from food, but also from alcohol or drugs. Now, the addiction pathway is signaled by a release of dopamine, which starts from the midbrain and goes to the frontal cortex. And that can help someone get this high or this pleasurable feeling from eating tasty foods or from using substances. And so people can get addicted when they have so much of the substance that it sort of hijacks their brain, that the front part of the brain, which deals with like planning, organizing, making decisions, really focuses on this substance and aims to either get more of it or take it more frequently in order to get that pleasurable feeling or that reward signal. So Ozempic may decrease that reward signal that people get from food. And so maybe by affecting this pathway, it can also decrease the reward signal from other substances, because dopamine is just known as like the pleasure chemical. So whenever we get this high or this natural like good feeling, it could be a release from dopamine in the brain. So one thought is that maybe our urges for food or these addictive substances can be sort of extinguished or decreased over time by a behavioral approach. For example, if one typically eats at 9 a.m., maybe push that back to 9:30 a.m. and then maybe later to 10 and 10:30 and so later in the day. And so these urges or cravings to eat certain foods may decrease as we sort of push aside some of our desires or inclinations for these food or substances.